This is Rob, owner of Stretch Therapy Vancouver. Today I want to talk about our feet and ankles. They are a very major important area of proprioception in our body, as well as our hips and our neck. Our feet, if they're not doing their job, tension can't move down, that tension moves up. Other joints are going to have to compensate. Generally, it's going to be our knees, our hips, and our back can take over. We don't do a whole lot of foot stretches in our classes. We do some calf stretches. The foot stretches, this can be done at home. So I want to update our stretch therapy foot and toe sequence for you to practice more often. Now, ideally, when we're standing, we have 3 points of contact on our feet: the heel, the ball of the foot by the big toe, and the ball of the foot by the baby toe. Now, I'm going to stand up. I encourage you to stand up as well. Fortunately, I'm not going to be able to see my whole body in frame, but you'll see my feet. So as we stand, we should be able to feel those 3 points of contact on the feet. So as we're standing with feet shoulder apart, I'm pulling my toes off the floor. So I'm pointing my toes to the ceiling, and our foot should act like a tripod on those 3 points. Again, ball of the foot by the big toe, ball of the foot by the baby toe, and then the heel. So let's just practice that. Let's bring the toes up and squeeze the toes to the floor. Just kind of go up and down just to see how that feels. Are we able to maintain those 3 points of contact? Good. Now let's rotate to the outside of the feet and to the inside of the feet. See how that feels. Now, are we actually rotating at the ankle and the foot, or are other things taking over? Are our knees and our hips taking over? Probably noticing it's the knees and the hips. I can hold on to my hips. I can feel these muscles activate. Let's bring one heel off the ground. Let's kind of shake out the toes and ankles. We're just going to do some limbering before we go into our stretches for our feet and toes. At the same foot, we place the top of the foot to the floor. Loosen it up, see how that feels. Try the other side. Heel off the ground, kind of loosen up the toes. That same foot, top of the foot to the floor, to the mat if you're using a mat at home. Now, I'm going to bring it back down to the floor. You can have a seat on the floor, on a bed. Now, before we were rotating our foot in and out, we noticed our knee and our hip was taking over. So we can have a seat on the floor. We can bend our knee, heel to the floor, and let's practice that. Can rotate in and out. We can see now, okay, my leg, my knee, the hip is taking over. So to stop that from happening, I'm going to support the knee on either side. And now I'm just going to rotate my foot in and out. Let's see how that feels on the ankle. Now we might notice new muscles in here being activated. So I'm going to do about 10 rotations. Maybe 20 rotations. I'm not going to really count. I'm just going to see how that feels. Okay, good. So now let's think about our foot a wee bit more. So you can even do this sitting on a chair as well. We just place the ankle to the opposite knee. If you're sitting in a chair, a little bit easier. I'm going to think about our foot. Now, do you have a high arch or a low arch? So we're going to think about some foot rotations. We're going to grab onto the ball of the foot right by the big toe. So I'm going to place both my thumbs on that position. I'm going to hold onto the foot. I'm just going to rotate the foot up. So I'm rotating that foot up to increase the arch of the foot. Kind of rotating in that position. See how that feels. How does that feel? Good. We try the other side. Now I'm going to place both my thumbs to the top of the foot on the big toe, and I'm going to rotate down. Let's see how that feels in that position. Now, which one of those positions are more challenging? Now, if we have a flat foot, we want to open up the arch of the foot. So in that case, we have a flat foot. We'll place both our thumbs by the ball of the foot. We're thinking about opening up that foot. Now, if you have a high arch, you want to think about place your thumbs top of the foot by the big toe and rotating down into that position. If your foot is bouncing, go in both directions. Okay, let's relax the foot. Now, if you want to get more into the plantar, massage that out, what we can do is we can pull the toes in towards your shin. So I'm really pulling that big toe in towards my shin. I'm going to take the opposite. I'm going to take my thumb. I'm just going to massage the arch of the foot. As you pull the toes in, you can feel a tight band. That's the plantar. So I'm massaging that. As I'm using my thumbs to kind of scoop that area. See how that feels. Might go pop, pop, pop as it releases. Yeah. Massage that out. See how that feels. Of course, you're welcome to spend as much time as you want with these techniques, depending on what you need. If it's easy, we don't need to practice that. Anything that's challenging that you experience during this practice, I encourage you to practice that a little bit more. Okay, now we're going to think about separating our toes. Now, there are products you can get to help separate the toes, little Joya toes and toe separators. I use those as well. I've even just taken socks, rolled them up, and kind of place those in between the toes as well. But we can also just use the opposite hand. So I'm going to take my hand, I'm going to place my fingers between the toes. So I got my pinky finger between the baby toe, the next one, put them in there, and squeezing those in there. Now, if you've never stretched out your feet and toes before, be very gentle. The skin between the toes are very thin and delicate. And now we want to get the knuckle of the hand to the knuckle of the foot, if that makes any sense. So we're going to bring that down. And when I'm doing it now, I'm bringing my fingers all the way in, and I'm grabbing my foot, kind of interlacing it. And from here, I can support my foot and ankle. I can just wring that in and out, see how that feels. In and out. You can do 10, 20, 30 rotations, depending on what you need in the moment. If it's more challenging, you can practice more. If it's easy breezy, you're already good at that. Goes in and out. Okay, good. Let's pull these fingers out. If we look at the toe, our toes should be even a little bit more separated. Okay, so let's go back to the toes. We're going to think about the baby toe and then that second toe. So what we're going to do is we're going to pull the toes apart and then in. Pull apart and then back in. Pull apart and back in. Good. So let's go to the next two toes. Pull the toes apart and back in. Apart and back in. See how that feels. Okay, let's go with these last two. Pull this apart and back in. In and out. See how that feels. Awesome. Okay, let's start at the beginning. Now we're going to pull the toes up and down. So grabbing those two toes, pull them in opposite direction, up and down. See how that feels. Okay, let's go to the next two toes. Pull those toes up and down. See how that feels. Good, let's go to the next two. Up and down. Great, okay. Go these last two, up and down. Okay, good. So now I'm going to go to the baby toe. We're going to think about the knuckles on the toe. I'll just demonstrate my hands so you can see a little bit better. I'm going to support the toe, and I'm going to bring the tip of the toe in and out. In and out. So I'm going to support the baby toe, the knuckle close to the foot, and then bring that toe in and out. Not a whole lot of movement in that little toe. Okay, let's try the other one. Supporting the knuckle, and just allowing the tip, that last little bit, that joint come in and out. Here we go. Okay, let's try the other side, supporting the toe, and letting the tip of that toe kind of come in and out. So, okay, see how the other side feels. I'm supporting that bottom knuckle, that bottom part of the toe straight, and then bringing that tip in and out. And again, if you experience any decreased range of motion, you can focus a bit more on those toes. Okay, try that big toe. A whole lot of movement in this one for me. See how that feels. Okay. So let's do one more technique for our toes. We're going to be rotating and twisting our toes in opposite direction, and then we're going to pull. So I'm going to go to the baby toe, twist one way, twist the other way, and pull. Try the other one, twist one way, twist the other way, and pull. Let's try the next toe, twist one way, twist the other way, pull. Try next toe, twist one way, twist the other way, pull. Try the other one. Big toe time. Twist one way, twist the other way. Not a whole lot in that one. Okay, good. So earlier I showed you a technique to help massage that plantar, where we pull the toes in and massage it. Now we're going to do a contract relax technique that we do with PNF stretching for the ball of the foot, for that plantar. So what we're going to do, you're welcome to use a mat on the floor. That's a little bit more challenging. So what we're going to do is we're going to kneel on the floor, other foot forward. We're stretching this back foot in here. I'm going to bring all the toes to the floor. If we have an issue, bring the heel out. So all of my toes now are to the floor in this position. To make this stretch even more intense, I can push down on this back heel. Our contraction, we're going to think about making a fist with this back foot. So we're thinking about squeezing our toes to the floor. The floor is going to support the foot, so we're getting that isometric contraction for about 6 seconds. After contraction, we're going to breathe out, relax the foot. To increase the stretch, I'm going to bring my hands to the floor. I'm going to bring this knee forward to increase the stretch to the arch of the foot. So let's practice that together. If you want to push down the heel to make that stretch more intense, you're welcome to. Let's squeeze the toes to the floor on that back foot. As we breathe, I'll count you down from 5, 4, 3, 2, and 1. No more tension. Let's relax that back foot. Breathe out. As we breathe out again, we can lift the knee off the ground and bring that knee forward. We can adjust that foot if we need to. If you want to push down the heel, you're welcome to. Let's squeeze the toes forward to the floor. We're making a fist with that back foot for 5, 4, 3, 2, and 1. Big exhale. Relax that back foot. Breathe out. As we breathe out, we can slide that back knee forward, increasing the stretch to the arch of the foot. If we want to practice that one more time, push the heel down, squeeze the toes to the floor. As we breathe, count you down from 5, 4, 3, 2, and 1. Big exhale. Breathe out. Slide that back knee forward. Okay, when we're done, we can lean forward. We can shake out the foot. And we're going to stand on up. We're going to walk around. We're going to see how that feels. We want to walk around on a hard surface. Good. Okay, I'm going to have a seat so you can see me. Okay, so let's think about the other foot. So a lot of these you can do watching TV, obviously that last contract relax technique of PNF stretching. We need to push onto the floor. Let's try the other side. So let's think about the other foot and ankle here. Now before we were doing our standard rotations, we noticed that the hip was really taking over. So let's gain segment control. Let's hold on to the knee. Stop the hip from taking over. We're just going to rotate the foot out and in and out. See how that feels. And we should be able to rotate out the same amount as we rotate in. If we can't, we might have some imbalances there, of course. Contact me if you want to focus on those specific needs. And shaking out the ankle. Might notice some new muscles being activated in here. Okay, good. Okay, so let's go into our techniques. If you're having to sit on the couch, you can just place one ankle to the opposite knee, or you can do this on the floor as well. So we're just looking at the foot, trying to determine if we have a high arch, a low arch, or a neutral foot. To help with that, let's rotate the foot up and down. I guess we can twist that. So we can place both our thumbs to the ball of the foot by the big toe. I can grasp onto the foot, and I'm just kind of rotating that up. See how that feels. If you have a low arch, this movement is great. Help increase the arch. Okay. Now what if you have a high arch? You want to rotate that down. So let's place both our thumbs to the top of the foot by the big toe. I can grasp the foot. And we're going to rotate them down, kind of twist it down. See how that feels. Doing about 10 or so repetitions. Kind of see how that feels. Chris, you're welcome to do more. Okay, now if you want to massage that plantar, if you just take your thumb right now and you push on that, you can't really feel that band. So to feel that band to get in there properly, you want to pull the toes in, especially that big toe. You can do this even just pulling that big toe in. So think about pulling the toes in, that big toe in towards your shin. Now we can feel the arch of that plantar. You can take the opposite thumb and just massage the inside of the arch. See how that feels. Sometimes it'll feel like popping, that bubble paper wrap they use for packaging. Pop, 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 pop. This might be easy for you. Well, that's great. You don't need to practice that too often then. Okay, let's think about separating our toes and wringing out the feet. So we're going to use the opposite hand. So I'm going to stick my pinky finger next to the baby toe, and we're going interlacing our fingers with the toe. And I'm trying to get the knuckle of my hand right into the knuckle of the foot. And remember, be very gentle if you haven't done this before, if you haven't done any toe separators. Use those before. Good. So I'm grabbing onto my foot, and I'm just wringing that in and out. I can support the heel, so it's not the ankle that's moving, it's actual foot. In and out, see how that feels. Great. Okay. Of course, you're welcome to do that longer if you like, but for time's sake, just wanted to show you that. I'm going to remove my fingers. See how that feels. Feel the toes. Oh yeah, already looking better. Okay, good. So let's think about our toes. We're going to think about pulling the toes apart and in laterally. So taking the baby toe, pulling that apart and back in. Apart and back in. Apart and back in. Awesome. Let's go to the next two. Pulling that apart and back in. In and out. Yeah. Okay, good. Let's try the next one. Apart and back in. A little crack on that one. How that feels. A couple cracks. Okay, final two. Apart and back in. Okay, let's start with the baby toe. Now we're going to think about up and down in the opposite direction. So let's pull those up and down, up and down. There we go. Yeah, no problem. Okay, let's try the next set of toes. Up and down in opposite directions. There we go. No problem. Okay, let's try the next two. Up and down. Ooh, that second toe is tight. Okay, let's practice on the final two. Big toe, second toe. See how that feels. Oh, there we go. Just crack out that second toe. There's a lot of tension there. Maybe you have some previous injuries. I was thinking I had a chair fall on that toe and lost that toenail. So there's still some tension in there. Okay, let's think about the knuckle of our toe. So remember, we're going to hold the base. That way we can just stretch the tip of the toe. So let's hold the base of the baby toe. Let's pull that in and up, down and up. Tiny little toe, so it's not a whole lot of movement. Let's try the next toe, holding the base. It's that last knuckle. Up and down. Awesome. Okay, let's try the next toe, holding the base. Up and down. Of course, we find any tension, you want to spend more time on those tight toes. Okay, let's try the next one. This one was tight for me. Oh yeah, there we go. Up and down. Bring that movement back into our feet so we can move freely. Okay, let's try the last one on the base. Yeah, this one has more range of motion than that other side. Okay, good. So now I'm going to go into that twisting motion. We're going to twist in one direction, twist in the other direction, and then pull. So we'll start with the baby toe. Let's twist one way, twist the other way, and pull. A little pop. Try the next one. Twist one way, twist the other way, and pull. Let's twist one way, twist the other way, pull. Good. Next toe, twist one way, twist the other way, pull. And the big toe, twist one way, twist the other way, and pull. Now, if naturally your toes curl inwards or outwards, probably inwards because we're wearing shoes, what we can do is twist on the opposite direction. So those feet are going out. So I notice, especially my baby toe is it's twisting in, so I want to make sure those are twisting outward. Okay, great. So let's go into that kneeling stretch for the plantar, and we'll go to that contract relax technique. Okay, so I'm gonna kneel on the floor here. These ones were stretching this foot here, so I'm spreading the toes out, bringing the knee forward, other foot forward. Yeah. We're thinking about making a fist with this back foot. If you want, you can push down on the heel to make it more challenging. So you're welcome to join me. I'm going to push down on the heel, but that's completely optional. Let's sing with that back foot. Let's squeeze our toes to the floor. I'm making a fist with that back foot for 5, 4, 3, 2, and 1. Big exhale to relax that back foot. To increase the stretch, we're bringing the hands forward. We're going to slide this back knee forward as we exhale. Doesn't take much. We're talking centimeters, millimeters at a time. If you want, you can push down on that back heel and squeeze our toes to the floor as we breathe for 5, 4, 3, 2, and 1. Big exhale. Good. Let's relax that back foot. We're breathing out. Bring our hands to the floor. We can slide that knee forward. We can adjust our toes. Let's practice that one more time. You can push down on the heel. We can squeeze our toes to the floor. Try to make a fist with that back foot. As we breathe, I'll count you down from 5, 4, 3, 2, and 1. Big exhale to relax that back. We can breathe out. We can bring that knee forward. Awesome. From there, we can lean forward. We can shake out that back foot. From there, let's get on up. Let's rise on up. Let's stand on up. Let's walk around. Let's see how that feels. Oh, that feels great. I'm looking down at my feet. My toes are nice and spread apart. I was mentioning earlier that my baby toe kind of slides under. It's not. It's all spread apart now. It's perfect. It's perfect position there. Awesome. So all that ankle sequence and that toe limbering, you can practice that daily watching TV. The contractions that we did at the end, I'd only recommend doing that a couple times a week at the most. We need time to rest, recover, and adapt. But you can go into this position without the contractions. If you want to finish off a stretch in this position, you can practice that as well. I hope that helps. Please let me know if you have any questions. Have a wonderful day.